Hi, I am a urologist and pelvic surgeon, and today I am going to talk about the difference between BPH and prostate cancer. If you're new here, I am a board-certified urologist and I make content on bladder health, sexual health, and much more. If you enjoy what you see, make sure you subscribe and share this channel with your friends. So many of you have been asking me to make a video about the difference between BPH or an enlarged prostate and prostate cancer. So I'm going to take you through exactly what are the differences between these two conditions, how they're diagnosed, and how they're treated. The two most common symptoms of BPH are difficulty emptying your bladder, meaning you might have to strain or have a weak stream and a post-void dribble, and also having a urinary symptom like you might have to go to the bathroom more often, having a sudden urge to go to the bathroom, and sometimes even waking up at night to urinate. What is prostate cancer? Well, prostate cancer is a cancer that can cause a number of different urinary symptoms, including difficulty emptying a weak stream, straining, as well as having issues with urination like having to go to the bathroom more often, a sudden urge to go to the bathroom, and even sometimes pain with urination. So, you could have pain at the tip of the penis when you urinate. That can be a sign of both BPH and prostate cancer. However, there are some key differences. The key difference is that with BPH, we find that it tends to be more of a problem at the beginning of the stream, whereas with prostate cancer it tends to be more of a problem towards the end of the stream. So, if you notice that your stream is fine at the beginning, but gets a little bit stuck at the end, that's more likely due to prostate cancer. Whereas if you notice that your stream is kind of weak or you have to strain to empty, that's more likely due to BPH. Now, another thing to note is that with BPH, typically men will have an almost normal PSA. With prostate cancer, men tend to have an elevated PSA. Now it is important to realize that an elevated PSA doesn't necessarily mean that you have prostate cancer. It could just mean that you have an infection, or maybe you recently had a prostate biopsy. But if your PSA is high and there's no other explanation for it, then it could be a sign of prostate cancer. In addition, if you're over the age of 50, it's important to get screened for prostate cancer, even if you don't have any symptoms. The reason being is that oftentimes early prostate cancer has no symptoms at all, and so screening is really important in those individuals. Now, how do we diagnose BPH versus prostate cancer? Well, the first thing we do is a digital rectal examination, or DRE. On a DRE, what we're looking for is, first of all, if there's an enlarged prostate, which you can feel as a kind of a swelling on either side of the prostate that is normally there with BPH, and also if there is any nodules or abnormalities in the prostate that could be concerning for prostate cancer. Now, just because you have an abnormal digital rectal exam doesn't mean you have prostate cancer. It's just an indication that we should do further testing. The next test that we do, a test called a prostate biopsy. A prostate biopsy is where we take small samples of the prostate to look at under the microscope to determine if there is any signs of cancer. Now, if your PSA is really high, your age is high, and your digital rectal exam is abnormal, then we usually go straight to a prostate biopsy. If your PSA is a little bit elevated, we may do a test called a prostate MRI first, and then based on what the prostate MRI shows, we may or may not proceed to a prostate biopsy. And the last test we do, a blood test for PSA. As I mentioned before, so how is BPH treated versus prostate cancer? Well, treatment for BPH is based on your symptoms. If you're having mild symptoms, then we usually treat you with either medications or simple interventions like a prostate massage or a bladder scan to empty. If you have moderate to severe symptoms, then we offer a number of different treatments, including a surgical treatment called a simple prostatectomy or a laser treatment. You can watch a video I made about all the different types of treatments available for BPH. Treatment for prostate cancer really depends on a number of factors, including your age, the stage of the cancer, and how fast the cancer is growing. For localized prostate cancers, we usually treat them with surgery or radiation. And for more advanced prostate cancers, we usually treat them with some type of hormone therapy. So I hope this was helpful. And bottom line is that both BPH and prostate cancer can cause very similar symptoms. And it is important to see a urologist or primary care doctor to get evaluated if you're having any urinary symptoms at all. As always, remember to take care of yourself because you're worth it.